Cataract is a change in the structure of the lens of your eye. So the lens of your eye starts out in life being crystal clear and flexible, allowing you to have clear vision and to be able to focus at different distances. If you're lucky, all the way out to the horizon and then back towards the tip of your nose. And that's the lens that we're born with and that we often take for granted. And then as we go through life and we hit our 40s and 50s, we start to lose that little bit of flexibility. And then we experience something called presbyopia, which is a lack of focusing power. Often that's when we start putting on readers. And then if we go on from that, naturally the lens starts to lose transparency. And when it starts to lose transparency, our visual performance starts to fall off. The loss of transparency is caused by a change in the proteins that make up the lens. So the lens is made up of crystalline proteins. They have a certain structure and arrangement, and as we go through life, the chemical structure of those proteins changes. The change in the lens structure is an inevitable part of aging, and if we live long enough, the amount of cataract and the impact the cataract that will have on us changes. So some people will maintain very good eyesight despite having cataracts and may not know they have cataracts until their 80s and 90s. But most people, when we get into our 70s and 80s or late 60s, will develop cataract. So there are lots of factors that affect cataract and can accelerate cataract. So the most obvious factor is age, UV light. So as you say, high sun exposure, smoking, diabetes. These are all genetic factors as well as lifestyle factors that can affect the formation of cataract. Cataracts can have all sorts of effects on your vision. Cataracts can simply affect the clarity of your vision, so sometimes you just don't see as clearly. That's quite a subtle effect, so often you can lose clarity of vision over many, many years and not really notice it because it's very, very gradual. Other symptoms that people describe with cataracts tend to be more noticeable, so things like glare are very commonly experienced by people with cataract. So if they're looking, for example, at headlights or they're driving at night, people with cataracts will often say that they seem to see much more glare with oncoming headlights than they would ordinarily. And very rarely in late cataracts they can affect colour perception. So cataracts will gradually shift your colour balance from a white-blue balance over towards warmer sepia, warmer colours, but typically it's loss of clarity. So cataracts normally present, or people with cataracts normally come in for review around their 50s, 60s, typically the 60s and 70s, so the 6th, 7th decade of life. So that's when we tend to notice those visual changes the most. If it might be glare with oncoming headlights, you might be struggling a little bit to see, to read, for example, or you may just find that your vision in low light is not as clear as you would like it to be. So the average age of cataract surgery in England is around your early 70s. One of the myths about cataracts is that they have to be ripe or mature before you have cataract surgery, or can be treated with cataract surgery, but that's not true. So you can have cataract surgery or lens surgery actually at any age, but typically when you start to form cataracts or when your vision is affected, that's the point at which we will consider surgery if all other factors are taken into account. So there's no need to wait. Sadly, we don't have a lens that's as good as a human crystalline lens. but there are excellent artificial lenses, and lenses are made from nowadays from acrylic materials of one sort or another. And so they are biologically completely inert, and then there are different properties to different lenses depending on the sort of outcomes we want to get from surgery. And intraocular lenses now last forever. Effectively, they're not just biologically inert, but they are inert chemically. There are lots and lots of different lens types that are available. So we call these intraocular lenses, and I tend to group them into three broad groups. There are monofocal lenses, which are lenses that give a fixed focal viewpoint, typically set for the distance. So with a monofocal lens, you would see clearly at distance, for example, reading a road sign if you were driving, or recognizing people's faces across a room. So that would be a monofocal lens for distance vision. And then another group of lenses are multifocal lenses. Typically, we might use trifocal lenses of one sort or another, and they would give you your widest range of vision without spectacles. So typically distance vision, intermediate vision, which is around about arm's length, and close vision, which is reading. So for example, reading a book or a Kindle, or looking at a smartphone. So those are multifocal lenses. And then there's another group of lenses called extended depth of focus lenses, which include extended monovision lenses, and they are lenses which stretch your focal range. So typically they give you very high quality vision in your distance and intermediate vision. So intermediate vision would be, for example, instruments in the car, or the mid-distance, or perhaps reading larger print slightly further away. You can mix and match lenses. You can power the lenses so that different eyes have different focal ranges. So you might have one eye that's optimized for distance and one eye that's optimized for near. But we can be a little bit more subtle about that. So we can overlap extended depth of focus lenses so that people have a much wider intermediate range of vision. And we can use different lens types in different eyes, because sometimes we see people who have already had cataract surgery in one eye and would like to be spectacle free or less spectacle dependent in the other eye. And so we can look quite carefully at that to see how we can maximize the range of vision while maximizing clarity of vision. So cataract surgery is performed in lots of different settings. Here we perform surgery in a private hospital. So you would come in on the day of surgery, be admitted. Surgery is day case surgery, so no need to stay overnight. And typically you would actually be in the hospital for some hours. We usually suggest that you allow a morning or an afternoon so that you can settle in, have the surgery, feel comfortable, refreshed, relaxed afterwards before you head off. But it's day case surgery, and you're here usually for a relatively short amount of time. We don't have waiting lists for cataract surgery, so it's not, the system is not the case that you join a long list of people who are each waiting for an operation, but we run a booking system, which is a live booking system. So largely we are just aiming to place you on a waiting list that's convenient for you. People have all sorts of different schedules that they run to. Sometimes it's work, sometimes it's recreation or holidays. So usually we are trying to fit you in to a time for your cataract surgery that you want to come in, rather than having to wait for a particular slot. So we're very fortunate here in that we have really excellent state-of-the-art equipment for all of our surgeries, cataract surgery being no exception. And we're also able to offer a very, very wide range of state-of-the-art intraocular lenses. So we're not really restricted in that use. And what we're trying to do with surgery is to balance the wishes and outcomes that the patient wants to get out of surgery with the current available technology that enables us to deliver that. So I started performing cataract surgery in 1994. I think I did my first case. And cataract surgery in my time of operating has changed enormously in that era. So one of the reasons that I found ophthalmology very interesting to be in is because surgery is evolving rapidly in all areas, and cataract surgery is no exception to that. So I started off performing a type of surgery called extracapsular cataract surgery, and now we use a different system of surgery called small incision phacoemulsification surgery. And so I've been performing that for many, many years, for many, many thousands of cases, and that procedure has improved amazingly, actually, technically, but also along with that improvement, if you like, in surgery, which improves outcomes as well as safety, has been a massive improvement and really variety of intraocular lenses that we now use in surgery. So the functionality of people's vision after cataract surgery is vastly different from when I started. So personalised care is really at the centre of what we do. We spend quite a lot of time finding out not just about the patients medically or ophthalmologically, but we want to know what they enjoy doing in life, what are their hobbies, what are their pastimes, where do they want their best vision to be, and then really looking at how that surgery can be performed in the setting of perhaps medical issues or ophthalmological issues that they may have, but really what they want to get out of surgery and how we can maximise the outcome of the vision for those particular things. Prior to cataract surgery, generally we want your eyes in tip-top condition. So for example, if there are any other eye conditions that you have, so one of the frequent conditions we come across is blepharitis, which is a sort of dandruffy condition of the eyelids. We like to treat that, which we'll pick up at the preoperative consultation. We like conditions such as glaucoma to be optimized. So again, I'll have a look at you and measure pressures of the eye, make sure glaucoma treatment's under control. And if there are any other pre-existing medical conditions, we like to make sure that they are as controlled as they can be before cataract surgery. So that may be a condition that's unique to the eye. For example, macular degeneration. We can take certain preventative or protective measures for macular degeneration, but it might also be general health. So for example, if you were diabetic or you had high blood pressure, again, we would like those conditions to be optimized so that you've got the very best chance of your best recovery. Cataract surgery is not painful. The surgery itself is immediate, so you can see blurry movement, you can see shapes, you can see lights, you can feel pressure changes, but nothing in that will hurt. So it's an experience in that way, sensory wise, but it's not an operation that's painful that you need to kind of grit your teeth to get through for those 10 or 15 minutes. Cataract surgery is a surgical procedure, and all surgical procedures carry risks as well as benefits. Fortunately, risks in cataract surgery are very low. So major risks in cataract surgery, things like infections, will vary between centres or between environments, but typically we're looking at infection rates of less than 1 in 1,000 sometimes less than 1 in 3 or 4,000. So infection tends to be the worst possible risk in cataract surgery, but is also infrequent. Cataract surgery can also lead to other complications. So sometimes there can be swelling of structures of the eye. For example, there can be swelling of the macula, which is a sensitive part of the retina. That's called macular edema. And we usually look at a risk of macular edema of around 1 in 200 or less. Other risks of surgery are retinal detachments or tears. So that's when the movement of cataract surgery can break a piece of retina inside the eye. That too can lead to problems. All of these risks, though, are uncommon, and most complications in cataract surgery are remediable. So, for example, if you suffer macular edema, that can usually be treated to cure with eye drops and very rarely injections. If you were to suffer a retinal detachment, for example, that would be expected to be reattached successfully in the vast majority of cases. And if you are unlucky enough to suffer from an infection in the eye called endophthalmitis, again, the expectation would be, provided it were caught in time or early, that would be treated to cure, again, in the vast majority of cases. So one of the really important aspects of cataract surgery and complications arising from cataract surgery is to ensure that you have medical follow-up in place and that you have access to medical care in place. Cataract surgery will typically take me about 10 to 15 minutes. It's not a painful procedure. It's a very immediate procedure so that you're aware of light and movement. But again, it's a very psychological process. So some people find cataract surgery really fascinating and find the whole process really fascinating. Other people don't find it so fascinating, and so that's why we have a whole range of anaesthetic options for cataract surgery, which means that we can get you through the surgery very comfortably, whether you're awake, asleep, or whether you have a bit of sedation. So cataract surgery has been around for a long time, in one form or another, probably for hundreds, if not thousands of years. So people were performing very, very, very basic forms of cataract surgery a long time ago. And modern cataract surgery, you could say, with intraocular lenses in the last 50 to 75 years. So in this last period of time, cataract surgery has come a long way. Now with modern surgery, because risks are so low, we advocate surgery to both eyes sequentially, provided there are no other complications. Cataract surgery is a one-off treatment. Cataracts don't grow back, and when we put new lenses in, the lenses don't wear out. So it's not the case that you would have cataract surgery, have the lens in your eye replaced, and that lens itself would then have a certain lifespan or wear out. So once that surgery is complete, then that lens will last indefinitely. So after a cataract operation, we expect you to be able to see immediately. We will place a little clear plastic transparent shield over the eye that you can look through. And when you sit up from cataract surgery, you can see through that shield. Your eye is not perfectly focused. You've just had an operation. It's blurry. You've got drops in. But generally, the vision is good enough to navigate, see clearly enough, for example, to see where you're going and to have a reasonable level of vision. And that ability to see reasonably well almost immediately after surgery means that having both eyes operated on in the same episode is viable for a lot of people. Recovery time in cataract surgery, again, is pretty quick. So really within an hour of the surgery, your vision would be reasonably good. The next day it would be much better. We expect you to certainly to be functional within a day or two, so you could bend down, you could pick things up, you could go out for a walk, you could see where you were going. 2-3 weeks later, it's much more stable. You will have had lots of eye drops before then, and then you're really getting onto your best vision following cataract surgery around the 6 to 8 week mark. Follow-up after cataract surgery, we usually look at about 2 to 3 weeks. Glasses after surgery, again, is a very personal choice. So some people like wearing glasses even when they have clear vision and don't need to. But largely we're trying to get people out of spectacles as much as possible. So we want our patients to be spectacle independent as far as they can be, but at the same time balancing that with clarity of vision. So driving after cataract surgery, generally we can get you back into driving within a week. So we expect most people, if they've got eyes which are good enough to drive and nothing else wrong with the eye, cataract surgery has gone well, we would expect you to be driving, reading a number plate, for example, within a week of surgery. Lots of people have loads of activities that they want to get back to and have been putting off. Perhaps they can't see so well to do things they really like doing. Generally, we ask you to take it easy for the first week or two. You can bend down, you can pick things up, you can be active in walking and getting out and about, but we like you to take it easy for the first 2 weeks. So no major contact sports, avoiding swimming, those sorts of things in case of injury, really, and also because largely we want you to put the drops in. So take it easy for a fortnight, golf, tennis, all of that after 2 weeks, please.